So you've been on an antidepressant, but it's starting to not work. Some of those old symptoms that initially went away are creeping back up again. So you call your provider, who suggests upping the dose of your medication. But here's my question to you. Is more always better? Or is there a point dosing-wise where the side effects start to take over? Stick around to find out. In 2019, the journal Lancet Psychiatry published a study that aimed to figure out the target dose for antidepressants, meaning the dose that gives us the biggest bang for our buck in controlling our depressive symptoms, while also minimizing the amount of side effects that we experience. Researchers evaluated all 5 SSRIs, so sertraline, escitalopram, citalopram, paroxetine, and fluoxetine, in addition to venlafaxine and mirtazipine. This was a meta-analysis of double-blind randomized controlled trials, and it included 77 studies and over 19,000 participants. And the way that researchers went about evaluating the antidepressant doses was by first converting the SSRIs to fluoxetine equivalents, which helped with the ease of comparison. The first finding that I want you to know about was that for the SSRIs in particular, there was a slow increase in effectiveness up to 20 to 40 milligram fluoxetine equivalents, which can be seen on the chart to the left, okay? However, above 40 milligram fluoxetine equivalents, there was no further improvement. And then when you look at the graph on the right, which looks at the patients who dropped out of the trials because of side effects, we see that as the dose increases, so do the side effects, with the most pronounced adverse effects happening above that 40 milligram point. What this means is that SSRIs work best in the low to middle ranges. So again, between 20 to 40 milligram fluoxetine equivalents. And then beyond that, side effects outweigh the benefits. So what happened with mirtazipine and venlafaxine? Mirtazipine was somewhat similar to the SSRIs in that the efficacy increased up to a dose of 30 milligrams. And then you can see that it clearly decreases. Side effects also continue to increase as the dose increases. Venlafaxine, on the other hand, was a little different. As you can see, the efficacy of venlafaxine increases fairly steeply up to a dose of 75 to 150 milligrams. However, instead of plateauing or decreasing like the other antidepressants, it continues to show benefit at higher doses of up to 375 milligrams daily. Again, with this medication, the higher the dose, the more side effects seen. Now, something that's interesting is that these findings were actually a replication of a prior study that was published in 1999 in the British Journal of Psychiatry. With this study, they found that there was a gradual increase in response of up to 21 to 40 milligram fluoxetine equivalents, with no further increase for doses higher than this. And then of course, they also observed more side effects with higher doses. So pretty spot on with what was seen with this newer study. So you might be wondering, why would this be the case? So something that not many providers who are prescribing antidepressants realize is that PET scans have shown that minimum therapeutic doses of antidepressants lead to an 80% serotonin transporter occupancy. So when you further increase the dose past this point, what we typically see is small increases in transporter occupancy, which relates to minimal benefits being seen clinically. Instead, what patients usually experience is an increase in side effects. So the big takeaway that you need to be aware of is the optimal dose range for the antidepressant that you're on, in case you're to have worsening of symptoms and your provider wants to make a dose adjustment. Because odds are, they're not going to be familiar with this research study. I've created a free PDF for you to download that has the optimal dose ranges for the antidepressants discussed today, and the link is in the description below. Now, if you want to learn more about antidepressants, make sure to click that top video.